Hey guys, welcome back to Melanated Truths, where we talk everything mental health and then everything in between. I am Lavonda Handy, licensed marriage and family therapist, owner and therapist at Truth Center for Health and Healing. And of course, we have here
Nicola Pierre-Smith, licensed professional counselor, therapist, and owner of Melanated Women's Health.
So, welcome back, guys. We're in 2021. We survived. We're here.
Yeah, the lights didn't go out.
Lights didn't
The
go.
world didn't come crashing in.
No animals running around like Jumanji. There are no zombies.
Yeah,
We're getting the vaccine.
4 days in, let's keep the momentum going.
Let's do this. So today we are talking about why people don't go to therapy. Previously, we given you guys 10 reasons for going to therapy, and we want to give the other side because there are some definite purposes for people that they don't attend therapy.
Yeah, and money is a huge barrier for sure. I think the range here in Philly is somewhere between 125 and 150.
Yeah, and that's pretty much up there. If you consider what people's financial placement is and how their stability is, could you imagine spending, 125 to 150 per week to attend
Yeah.
therapy? That could get pretty expensive. And I'm like a budget queen, and I know you're like all about
I'm
your
on the money.
budgeting, right?
Yeah.
So we rather have the money coming in and going out. So when it comes to balancing our mental health, sometimes that's an additional stressor to consider, like, okay, how am I going to finagle going to therapy and keeping my lights on?
Yeah, and I was giving the range just here in Pennsylvania, but if you think about states like California, I've seen ranges from 200 to 250, so it's really up there, the cost of therapy. But we should think about there are some loopholes that exist, and I say that cautiously, that there are some loopholes that exist, that if you have insurance and have the privilege, especially coming out of a year like 2020, that you have insurance, the copay is usually significantly lower than the actual cost of therapy. And at least during the pandemic, multiple insurances were waiving the cost of therapy. And what that means is that it's essentially free if you have insurance. Now, another loophole to that is thinking about sliding scale or low cost options. Do you want to say a little more about that, Lavonda?
Yeah, sure. So the sliding scale options, there are some therapists out there that will have lower fees, maybe based on your current income or your circumstances. They take that in consideration, and they offer scales that are often, anywhere from $50 to $100, which is more probably affordable for people on that bi-weekly to even monthly basis for their financial purposes.
Yeah, and if you live close enough to university or college campuses, oftentimes they have a counseling center that services the community. And sometimes I hear people say, well, they're just trainees or they're not licensed. And the thing is, if you went to a hospital, not everyone there or like fully licensed or credentialed, they're doing fellowships and residencies. So it would be the same thing that's occurring in the community counseling centers or college counseling centers.
Yeah, and something to keep in mind is with some of those unlicensed professionals, they are supervised by licensed professionals, and there also is still a standard that they have to function by. It's still the same ethics that they have to rule by, and being always putting the client first in a way that is keeping them safe. So unlicensed, licensed, that professional is still being monitored with the treatment that they're giving you.
Yeah, and a way to think about it is that if this is the only option that you have to really get a low cost therapy option, is that think about the college centers as you having a full treatment team. It's not the therapist, but you have the supervisor, you have the department, and people who are, your information is still kept confidential, though you do have multiple people supporting your care.
That's the way I learned, and having that team of support. I mean, even in the private practice sector, I have a consultation group that I turn to for support
Yeah.
to, with my clients because they're really important to me and their care and treatment is really important. So, team aspect, licensed, unlicensed, there are options for you
Yeah.
to get the treatment that you need if you can't afford it financially.
Yeah, so think about the financial barriers, just a problem that can be solved, and it's not something to deter you long term from therapy.
For sure. And so another reason people may not go to therapy are some emotional barriers, emotional, relational. If we think about like just the fear, shame, or embarrassment that comes up from
Mhm.
going to therapy, like it can be pretty intense for someone if they just don't know what to do with those emotions and what people may think of them when they walk into the therapy room or if any of their family members finds out that they're going to therapy.
Yeah, and if you think about it, it's a really counterintuitive thing in that there is shame and embarrassment towards seeking help from a therapist. However, seeking help from a therapist, it's potentially the only space that you may have that there is no judgment that happens, and you're treated with unconditional positive regard for who you are as a person.
It's definitely a really safe space that we like to create for people to say whatever they want, to feel however they feel, and then work through those feelings. It is very natural for people to initially have that shame and guilt because what can come up is this is the first time you as the individual is are saying these words out loud, right? When we think things in our head, it could be one space and we can be like, oh, and kind of push them to the side. But when you say them out loud, it definitely makes them real and something that you really have to deal with essentially. And that can be scary as well.
Yeah, and one of the ways that you can really help yourself to overcome some of those emotional barriers would be at least give yourself the opportunity to have a consultation phone call with a therapist, because in that phone call, that's, I like to tell people, that's where the work starts, because you get to decide, do you think this person is a good fit, the questions that they're asking and the flow of the conversation, you get to use that as a part to overcome some of those barriers.
I say setting up that consultation is just as much as like getting the gym membership and just showing up that first day, right?
Yeah.
So as soon as you get into the gym and you're there, it's like, okay, I made it. And then it gives you the safety and the confidence to keep coming back. And it's just like a muscle that you're working, and it's just surrounding your heart and your mind.
Yeah, and that's a good analogy, because I know for every gym membership that I have signed up for on the very first day, they even walk you through the gym. This is where the free weights are, this is where that thing is. If you need further services, this is where the reception is. Like, they give you a full walkthrough, and that's a similar thing that happens on a consultation call with a therapist. They're also free. So you have that too. There is no financial barriers with a call. They're talking you through what their background is, getting a brief overview of what your needs are, and then together the therapist will even help you decide if they are a good fit or not a good fit, and they'll even give you resources.
Yep. Which is super helpful because if you're not, or you want somebody else to that you can turn to, and feel safe and confident that that person was willing to even have that conversation with you, even if you're not a good fit.
Yeah. And I know I do this, so I don't know if you do it, Lavonda, but I'm having a conversation around reimbursement. How are you going to afford it? Is the insurance company going to do that? What's your financial situation? Because in that conversation, the therapist is also getting a feel of what your financial situation is so that financial hardship doesn't enter the relationship. And typically, most therapists, I know I definitely do this, is help you find the information about what are your health benefits from an insurance standpoint, because that can be hard navigating by yourself.
I know it definitely, even as a my personal self, calling the insurance company for my own like health is always a doozy. So if you have a provider that's willing to do that, then that is really awesome. And I definitely offer that to my clients as well.
Yeah. So, cultural barriers. So, when I think about cultural barriers to therapy, like I even think of the Caribbean culture. Therapy isn't necessarily something that's accepted or embraced, or even mental health issues. So, that could be a barrier if you're from culture, whether geographically, ethnically, religious cultural background that doesn't support therapy, then you may be less inclined to then seek out a therapist.
For sure, there are different views and stigmas that go along with going to therapy in some cultures. Um, that saying behind like we keep everything in the family.
Mhm.
Uh, and that saying could also lead to just not talking about anything at all.
Mhm.
So it's really not, you're not used to what it means to go to therapy and have someone just in general to offer you help that isn't your own, because there's this stigma or this belief in cultures that you have to do everything on your own, or that the church will manage those things for you.
Yeah, and I think about too families with children who are minors under the age of 14 can't necessarily make a lot of their decisions for care. The mistrust or concern that something will be said to this professional that will have legal ramifications on the family. So, like cultural beliefs around interacting or engaging with the health sector could be a barrier, and you can overcome that barrier by looking for a provider that potentially fits your religious background, your ethnic background, and just your geographical background in the world if you're not born and raised in America.
Because then they know the cultural beliefs, the cultural norms, and they can help you navigate, how to address whatever interpersonal relations that you have with yourself, and then make it safe therapeutically for you.
Yeah. And even if you were thinking, well, the religion is that's the core piece of what you're looking for, there are pastoral counselors who they went to grad school just as you or I did, Lavonda, and it's just that they did it through the lens of a religious model or framework to guide their therapy practice.
And that's super helpful for people. And often we have clients of color that turn to us because, if you think about it, in the system of therapy, people are not used to seeing people of color as much anymore. Besides the cultural beliefs, they're not used to seeing people that look like them.
Mhm.
So when that opportunity is presented, you want to be able to talk to somebody that has more relatability to where you come from, essentially.
Yeah. So even though there are financial, emotional, cultural, or relational barriers, there are ways to overcome those barriers.
And what I like to think about is also thinking about some of those relational barriers. If we think about um, if we are LGBTQ,
I mean, maybe accessibility, maybe where they live, they're in such a rural area that they can't find a therapist that fits their preferred background. And that's where telehealth has opened up the window for that you could be in a rural area and further away from a therapist that's in the city, so you couldn't commute there easily for sessions, and now you could consider doing that remotely via telehealth.
which I really appreciate, because I actually had a client way out in Pittsburgh, right? Like, if you don't have access to therapy or a therapist that looks like you or that has any knowledge of your situation, it's nice that you can even expand your look, just if you're using your insurance, or if you just look up any directories that list therapists within your state, you are definitely be able to find someone.
Yeah, and to go back to what you were saying earlier with someone's identity, we're thinking because society has probably marginalized that identity. I think you said LGBTQ. So, with that population, there are many providers from different social backgrounds who also identify as LGBTQI that would be available for you as well. It's just that you're filtering your search for that.
So that's just a helpful list of, some of the reasons why people don't go to therapy. I think they are all initially some really justifiable reasons that will
There
cause
are.
people to hesitate to go to therapy, but there are options to get around. Thank goodness for the internet, and also like this platform of using telehealth these days, because I think that wasn't always an option for us, and the pandemic has now created a space where people can have access to therapy so much more than before, because maybe your schedule didn't even fit it. If you think about, like, I just don't have time to
Right.
go to therapy, and now telehealth creates this space where, like, you don't have to travel to go to therapy. You can sit right in the comfort of your home. I know we do therapy sessions when people are in their car. If you have an office, you can do it in the middle of the day for your work day. So it's definitely more accessible. You just have to navigate and kind of filter, like you were saying, your search of what you're specifically looking for.
Yeah, and I'm happy you were saying that with telehealth, that being able to see clients while they're in their car, not driving, but in their car, because one of the barriers though to telehealth is that people may not necessarily have a private space, and thinking that potentially someone in the home or the space that they are will overhear them, because I really think about people who are going through abusive situations at home or who live in homophobic environments and wanting to work through that in a therapy session. Being inside your house where someone may barge into your room if they don't have great boundaries isn't necessarily a safe space, though you could be in your car to create some privacy for that.
So there are definitely reasons, but if you just reach out to someone, I think they can definitely help you navigate how to
Yeah.
get through it. Nicole and I are always available. You can just shoot us an email at melanatedtruthllc@gmail.com, and we will definitely be willing to help you kind of navigate that search and find somebody that's appropriate for what your needs are. Um, and we hope this list is helpful, and maybe it's giving you some support to think about different ways that you can reach out, um, and get past that fear or that shame, and reach out for professional support if needed.
Yeah, it's just a problem that you can solve like other problems that you've encountered.
For sure. So be sure to like, comment, subscribe, and we will see you guys next week.